Welcome to Bitesize Digital Training. This is a programme of work to support Greater Manchester general practice with quick and accessible digital training. Today we're going to look at Copilot chat and what you need to know. The purpose is to enable our Greater Manchester general practice workforce with the knowledge and confidence to use Copilot chat safely and effectively for everyday tasks at work in general practice. We need to understand its limitations, governance requirements, and what good practice really looks like. My name's Chris Nortcliffe. I am a GP in Manchester and I am the Chief Clinical Information Officer for Greater Manchester Primary Care Provider Board. First and foremost, we need to understand what ChatGPT is. Similarly to any other GPT, which is a generative pre-trained transformer, a type of AI technology, it is a tool to augment, not to replace human judgment. It can save time, improve quality, and support decision making, but it must be used responsibly. And hopefully we're going to try and work through that briefly today. So, what is Copilot Chat? It's an AI assistant built into Microsoft Teams in the Apps tab. So it works inside your Microsoft Teams tenancy. You don't need to download a separate program. It works within the secure Microsoft 365 environment. That means that it's not taking anything you enter into the Copilot chat and using it to train the product elsewhere. Everything you write stays inside it. It also means that with this particular model, it doesn't remember what you've put in. It doesn't keep a history of your previous searches. It is and works in an instance and then forgets it. So you may be familiar that there's various other types of Copilot around and may be wondering why we're talking about Copilot Chat today. So Copilot Chat is included within the NHS.net Microsoft 365 suite of tools. It is slightly different to what's called Microsoft Copilot 365 or any of the other enterprise versions that are used in various businesses. So Copilot Chat, as I've mentioned, works within the Teams environment. However, it doesn't have access to lots of your other Microsoft 365 tools. The Microsoft Copilot 365 does use access to other things, so it can access your emails, it can access your files, it can access your calendar or your Teams calls. Copilot Chat doesn't do this, it's more limited than that. So if you want to find out where it is, this is a screenshot from my Teams screen, and you can see the arrow here points to where I have the Copilot Chat icon in the list down the left hand side. If it doesn't show there, it just means that you haven't installed it from the app library yet. So you just need to click on the apps button lower down in the column there and type in Copilot, and you can see here that it comes up, and you just need to download that, and then it will save onto your icons on the left. So I really want to talk about the safe use principles and how we're going to make sure we're using this AI technology safely. So really importantly, we want to talk about information governance and safety. You must only use any AI really, but in particular we're talking about Copilot Chat today. Only use it with information that you are allowed to handle. Do not use identifiable patient data. It's really important for information governance that we don't do this. And treat it like any other digital tool. Use professional judgment. Make sure that you're thinking about information governance whenever you're entering data into a digital program. at the moment, AI shouldn't be used for clinical decision making, and that is very true within Copilot Chat. It can help explain or summarize things, but cannot diagnose, it cannot prioritize patients, it cannot offer treatment choices, and it should absolutely not be used to interpret test results. Accuracy and oversight. Always check the outputs of any AI you use. AI can be confident but wrong. AI doesn't think. It uses huge amounts of training data to look at the probability of what the next part of a word or next word is going to be. Someone once likened it to a enthusiastic puppy that it just likes to please, and I think that's very true. So you must always check what the outputs are. You are accountable for any decisions and documents that are produced through AI. There is no defense in saying that's what the AI said. It is purely a tool to support you, but does not take away the primacy of your decision making. I think it's important that business owners, or in our context, GP partners, have oversight of what AI is being used for within their organizations, and ensure that appropriate policies and procedures are in place. And I think it's worth mentioning that it's a good idea to consider developing a practice policy for the use of AI within each practice. Good prompting practice. So this is really important. With AI, you get out what you put in. Prompting is the process of asking a question to the AI bot. So it's important to be specific. What are you looking for? Who's it for? What tone do you want it to use? What format do you want the output to be produced in? You want to provide context where possible. And also you can ask it to check its own work. So for example, you can ask it to highlight any parts of this output that may be incorrect or need checking. And that sometimes seems like a strange thing to do. Ask what it might have made incorrect judgments on, but actually it's a really good practice to get into. When we come to prompting, there are various frameworks out there about how to do this, but I'm just going to talk you through one that I particularly like using, which is the CoStar prompting framework. Now, it's very simple. C is for context. So this is the background info or specific circumstances relevant to the question. Objective. This is, what is the goal or purpose of the prompt? Next, S is for style. Do you want it formal, casual, technical, creative? T is for tone. Might seem similar to style, but actually when we think about it, it is subtly different. So this is the emotional tone or attitude of the output. For example, do you want it to be in a friendly tone, a professional tone, an instructive tone? A is for audience. Who's the output for? Who's going to be reading this, and will they be able to interpret it in the way that's intended? And finally, R is for the response format. Do you want it in bullet points, paragraphs, lists, or do you want a step-by-step guide to be produced out of it? I thought it would be helpful to run through some use case examples. I've got some potential use cases that clinical staff can use, but also some non-clinical examples where you might get benefit from using Copilot Chat. So, for example, summarizing non-patient specific information. This might be, for example, explain a nice guidance on asthma management in plain English suitable for a patient leaflet. Obviously, any outputs need to be thoroughly checked, particularly if it's being shared with patients, to make sure it's accurate and correct. Or it might be to summarize this long email chain about flu clinics into key actions. Now, again, it's worth noting that with the Copilot Chat platform, this would involve you copying and pasting the body of text from an email into Copilot Chat because it doesn't have direct access into your Microsoft Outlook inbox. Always be careful what you're putting in, particularly if you're copying and pasting, to make sure that there's no patient data and there's nothing sensitive that you shouldn't be putting into the Copilot. Drafting professional documents is another good use case. So I always think of this as turning your notes into more formal documents. This might be drafting reports or clinical governance updates, creating a template for an MDT meeting agenda, or for example, you might ask the Copilot to create a one-page summary of DOAC monitoring requirements for staff. Again, I would frame this around exactly what you want it to produce. So I want to produce it for GPs or the full clinical staff in a general practice surgery, and how you want it to come out. Do you want it to be paragraphs? Do you want it to be bullet points? Or do you want a step-by-step guide to completing DOAC monitoring? This is where the prompts really come in handy. Patient communications for non-identifiable patient communications, so no patient data in this, more generic things. So you might ask to get to draft a generic message for SMS recalls, inviting patients to book a BP check in a friendly but professional tone. Another element you could add to this one is, and keep it within one SMS fragment. We are increasingly conscious of costs, and SMS fragments do add up when you start using them more and more. So I think that's a really good opportunity to use it. Another example might be to write an explanation of the difference between an urgent and a routine appointment for the practice website. Again, check the outputs to make sure that it's appropriate, but sometimes it's really difficult to turn our ideas of information into legible, readable text for something like a website. You can also make sure it does it in accessible language, making sure that we meet the accessible information standards that we're all subject to. And education and continuing professional development. So an example here might be, create a quick revision sheet for explaining red flags for back pain. There's obviously many other examples we can use there. When it comes to non-clinical examples, we might want to look at email and document drafting, so creating letters, newsletters, or policy drafts. Or you might ask the Copilot to draft a polite reminder email to staff about completing mandatory training. I know many of us will have received those in the past, and putting it in the right tone is really, really important for getting our full uptake of that mandatory training. Meeting support, so you can ask it to summarize meeting notes. Obviously, again, this requires copying and pasting into Copilot, because it won't be able to access your files. You can suggest agendas based on inputs you give it, so things that you topics that have come up, and maybe suggesting an agenda. Again, extracting action logs from minute notes, so again, it requires copying and pasting. So another one is workflow efficiency. So it might be that you want to ask the Copilot to rewrite this information in a clearer, more patient-friendly format for our website. That could be a time-consuming task if you were doing it individually, but Copilot can do it in a matter of seconds. You might also want to turn these bullet points into a structured standard operating procedure outline. Again, turning your work, your thinking, into more accessible formats for professional use. So you can also use it for data interpretation, and this is slightly looser, so it's all important this is non-clinical data, but where we're coming from on this is that Copilot can help explain trends without touching the patient data. So for example, you can ask a generic question like, explain what a month-on-month rise in appointment DNAs could imply and suggest strategies to reduce them. It might just kick you off in the right direction to making some really important changes within practice. So risks, limitations, and how to avoid problems. So some common risks. Hallucinations and incorrect outputs. I'm sure we're increasingly heard about hallucinations, also sometimes called confabulations. So this is where, as I mentioned earlier, the AI is not thinking. It is predicting what the next word should be in an output, what the most likely fit is for that output. It can sometimes make things up, and you can get some really subtle differences which on the face of it could make sense, but when you check it thoroughly, it's important to make sure that anything that is a hallucination, is incorrect, is edited. Over-reliance on AI. It is not a panacea. It does not replace all of your work. It is a tool, as mentioned before, to augment your work and improve your productivity. So don't use it for everything and every part of a workflow. Use it to support you to be more productive. So I've mentioned before, what you put in is what you get out. So poor quality outputs come from vague prompts. Make your prompts as good as possible and you'll get the best outputs you can. Do not use sensitive data. Even though with Copilot Chat it's staying within the environment, we should not be using sensitive data and processing it within an AI GPT. Again, there's sometimes a mistaken assumption that it knows all local context. In Copilot Chat, it is not going to learn from your previous prompts. It does not know things that are going on in your local area. It does not know the local politics or the environment that you're working in. So make sure that you bear that in mind when creating prompts and reading outputs. How you might mitigate? Always use the human in the loop approach. So no AI should be working autonomously in this context. It's important that there is always a check and review that happens with every output. Make sure that you use the appropriate level of detail when writing prompts. The more detail you put in, the more accurate your output will be. But equally, sometimes when it's for example, when you're producing outputs that are going to be shared with patients, sometimes a more generalized input and less specific can be helpful to create the level of detail that you want in the output. Always ask Copilot to list any assumptions made. This is a really useful tip to whenever you're producing anything with AI, ask Copilot to self-appraise itself. And sometimes it can get some really useful pointers to where you might go and do a little bit of closer editing. I think this is a really helpful one to look at. So just a few final thoughts at the end of this short session. GPTs such as Copilot are productivity enhancers. They're not clinical tools. We shouldn't be using it for direct patient care ever. Safe use depends on good judgment, clear prompts and verification, ensuring that there's a human in the loop at all moments. Start small. Look at summarizing, drafting, rewriting or explaining content. Start getting used to using AI. You might go away and say, ask Copilot to explain how you can best use Copilot. That's a perfectly reasonable thing and a really good place to start. But don't be afraid to go and ask it things, try things, see how you might get the most use out of it. And just be safe. Don't use identifiable data. That's a real key one to keep in mind. So that's all we've got time for today. Thanks very much for listening, and hopefully I'll see you again on another Bitesize digital training.